Changes in sleep are commonly reported after brain injury and stroke. These changes can occur whilst in the hospital environment as well as longer term after discharge home. These changes in sleep can be due to a number of reasons, including the brain injury itself, changes to daily activities and routine, medications, pain, incontinence, and changes in mood such as feeling low or anxious. We asked Sue how her sleep changed after her stroke in 2010.
I have extreme hypersensitivity as a result of the stroke, and therefore I'm unable to lie on my affected left side. So I've had to adapt the way that I sleep. I start off sleeping on my back, and then during the night I turn over onto my right side. And that is hard to get used to because my left hand has no real movement, and sometimes I can end up scratching myself during the night.
This video will provide more information about the type of sleep problems you might experience after brain injury or stroke, as well as some tips about how you might be able to improve your sleep. Let's start with insomnia. Insomnia is a sleep disorder which is characterized by difficulties initiating and maintaining sleep. In the day, people with insomnia can feel very tired or low in mood. It is thought that at least 1 in every 3 stroke survivors experience insomnia. The National Institute for Health and Care Excellence recommends a treatment called cognitive behavioral therapy, or CBT for short, for insomnia as a first option for treatment. Although more research is still needed, there is growing evidence that CBT for insomnia could be effective for some brain injury survivors. Here are some suggestions of things you can try yourself to improve insomnia symptoms. Try to keep a regular sleep-wake cycle. Even if you had a poor night's sleep, still try to get up at your normal time. This can be very difficult, but sleeping in late can make it harder to sleep the next night. Make sure your sleeping environment is comfortable. This means dark and not too hot or cold. If possible, try to get regular exercise during the day. Avoid watching television or using your screens right before bed. This can be because bright light affects your ability to fall asleep. Practice relaxation techniques during the day. You can use these before going to bed and during the night if you are struggling to get back to sleep. Finally, try not to nap during the day as this reduces your body's instinct to sleep properly at night. This can be very difficult for some people after stroke, so if you really need a nap, then try to avoid napping late in the day and keep it short. If changing your sleeping habits has not worked, you can talk to your GP about whether they think CBT for insomnia is a good option. This is what Lucy has to say about her experiences after stroke.
I've had sleep issues ever since I've had the stroke. I fall asleep, but do not sleep through the night, so I always wake up tired and have severe fatigue most days. I believe that sleep hygiene is of huge benefit, and I tried to my best to improve my sleep hygiene, and I've in fact tested the sleep app called Sleepio, which does help enormously, but it is a long 6-week program, which does take time and effort. Small little things help as well, making sure I go to bed at the same time every night, making sure I wear an eye mask at night helps also, especially in the summertime.
Next up, we have sleep apnea. This is when your breathing stops and starts during sleep. Sleep apnea can contribute to feelings of tiredness and make it difficult to stay awake during the day. It can be hard to tell if you have sleep apnea on your own, but someone else can help to try and identify if you have certain symptoms. These symptoms include loud snoring, breathing stopping and starting during sleep, and making gasping, snorting, or choking noises during sleep. If you think you might have sleep apnea, you should make an appointment to see your GP. They will be able to assess you and see if this is the case. If you are found to have sleep apnea, then you may be given a device called a CPAP machine, which gently pumps air into a mask which you wear during sleep. Your doctor may also suggest lifestyle changes if needed, like stopping smoking, doing more exercise, and reducing alcohol intake. Third on our list is sleep cycle disruption. Some people find that their normal sleep patterns are changed after brain injury, so that they are unable to follow a set pattern for when to sleep and when to wake. it may feel a bit like you are constantly jet-lagged. Treatment will depend on the nature of your changes, but there are a few things you can try yourself. First, trying to ensure you have a consistent sleep-wake schedule is a good start. This might mean needing to set an alarm or keeping a sleep diary to figure out what sleep pattern works best for you. If you struggle to fall asleep at night and have difficulty waking up in the morning, then exposure to bright light in the morning might help. If you experience the opposite, then light exposure in the evening may be helpful. So, what happens next? In some cases, your sleep problems might resolve on their own, but if you are concerned or have tried making changes without success, then it is advisable to speak with your GP or another clinician involved in the care following your brain injury. They may be able to check whether changes are needed to your medications, offer other treatment options, or refer you to another health professional if needed. Finally, there are a number of research groups across the UK trying to improve our understanding of how brain injury impacts sleep. Dr. Melanie Fleming, a research fellow at the University of Oxford, has this to say.
It is heartbreaking that so many people experience problems with sleep after a brain injury and don't receive the support they need. We are incredibly grateful to our funders for enabling us to try to better understand how sleep is affected by brain injury, such as stroke, and to investigate treatments to boost sleep and improve recovery.
We hope you have found this video helpful and are able to implement some of the suggestions to help you sleep better.